Hi everybody, this is Dr. Joe with Change Your Health, Change Your Life. Today I wanted to talk a little bit about chronic pain, and often that's attributable to discomfort throughout the entire body. Fibromyalgia is one, chronic fatigue, you see headaches, diffuse joint pain and so forth, and it's something that really affects a lot of people. One, I think, is understanding that often when we see chronic pain where it starts to affect the whole body, that's a systemic problem, meaning that it's not like you bumped your elbow and your elbow just hurts. There's pain throughout the entire body, which means it's not the joint that's the problem. There's something else going on somewhere in the body. It's affecting everything, your perception of movement, your perception of how you feel, the sensitivity that you have to different forms of pressure or pain. And as a result, it lets us know there's something much more significant or serious going on in the body. Now, what we know by studying the nervous system is that if the nervous system isn't working as well as it's supposed to, it tends to become hypersensitive. And what that means is the same amount of pressure that one person might not feel, another person may feel that's hypersensitive, might feel that pressure 10, 100, 1,000 times more. And as a result would react differently to that type of pressure. A good example would be if you had a blister on a callus. If you take that callus off, what you'll notice is the skin that underlies it is extraordinarily sensitive, right? You'll notice if you put your hand under hot or cold water, or you touch something, whoo, it becomes much more sensitive to the same stimulus that you gave to the callus next to it, and you didn't even feel it. Often that can happen in the neurology throughout the entire body. So what we know through science is the more fixed or stiff or rigid the spine becomes, we know then that the nervous system becomes more sensitive. The nervous system doesn't perform as well as it's supposed to. That means the messages or signals or information or data that your brain is trying to send to a body part or organ, or that information that's coming back from that body part, isn't all getting there. Some of it's getting there, but all of it isn't getting there, and your brain starts to perceive that as hypersensitivity. It starts to perceive it, or have it, it's probably not worded as well as it should be, but it starts to perceive that as a distorted signal or distorted information. And as a result, it starts to misread it because it's making decisions based upon what it's receiving. But if it's only receiving half of the information or half of the signals, the body doesn't react the way it's supposed to. The nervous system doesn't react the way that it's supposed to. So what we notice is people that have sicker spines, people that have spines that have areas that are out of alignment, that are kinked, that are what we call technically, a word very specific to chiropractic, is a subluxation. Subluxation. That's a word very specific and unique to what we do as a chiropractic profession, much like gingivitis would be to a dentist, or arterial sclerosis would be to a heart doctor. That word means that the spine is out of position. And what's unique about that with chiropractic is we know that the subluxation affects the flow or the ability of the nervous system to communicate. So it's not that it's just misaligned or stuck. To be a subluxation, that means it's misaligned or stuck, and or it's affecting how well the nervous system is communicating to the body as well as it's supposed to. And therefore, if you don't get those messages, most people will automatically tell you, well, the body's not going to work as well, and it's going to start to get sick. One of the effects of subluxation is chronic pain, a distortion by the brain in perceiving itself, the brain perceiving the body, and therefore it starts to distort some of the information, and those people start to have much more chronic sensitivity or chronic pain. So the best way to check that, and the only qualified person to evaluate you for that, is a chiropractor. So a chiropractor is going to be very specific. He or she is going to look at the spine, and many of us use many different tests. Most chiropractors use some similar testing. Often we'll stand you on scales to see if you're balanced. For example, if I'm 200 pounds, I should weigh about 100 and 100 pounds on each scale, totaling 100 or 200 pounds. Some of us will measure heat transferred from the spine, which would incline there's inflammation there in the spine, which would incline there's pressure on the nervous system, or irritation in the nervous system. We're going to check motion, we're going to check posture. Many times we'll use x-ray, many times we'll use machines that could check the sensitivity of the skin, if you will, and that allows us to detect how well the nervous system is working. There's other measurements that could check how well the heart rate is able to vary itself. That's called heart rate variability, and along with other tests. So there's many different tests that are used. Remember, the ultimate effect of all those tests are to check to see where the spinal neurology, where the nerves are not communicating as well as they're supposed to, because that indeed defines what a chiropractor looks for, and that's what we're trained specifically and qualified for, to identify, locate those, and correct those by means of an adjustment. Now, many times the spine gets out of alignment from daily use or gravity, stress, traumas, things that we do to our body, things we put in our body. So as a result, it's going to be critical for, just like you would with your teeth, once the spine's healthier, it's important to get checked periodically and make sure the spine stays healthy, because we don't want it to get sick again. And it got sick in the first place because, no offense, but you didn't take care of it in the first place. Many people don't even know you're supposed to take care of your spine. Some people, unfortunately, don't know you're supposed to take care of your teeth. So our job as chiropractors, a big part of our job is to educate people towards why they need to take care of the spine because of that nervous system, and that's what's so critical. Guys, this is we're out of time. This has been Dr. Joe Borio with this week's Change Your Health, Change Your Life. We have a great nutrition workshop going on in our office. This weekend we're going to talk about nutrition, or I'm sorry, next weekend we're going to talk about nutrition. We're going to talk about the neurology of the body. We're going to talk about how to make your body work better. We've got some practice members in there who are going to share a little bit. It's going to be exciting, so I'm looking forward to everybody being there. Certainly you can check out our website and get more information. You can call our office anytime. This has been Dr. Joe Borio with this week's Change Your Health, Change Your Life.